Kettlebell Drenga. Rating season is upon us. The battle for the title of North American champion returns to the Twin Cities for the 2024 WKSF North American Championship. Register today for your chance to fight for glory and claim your spoils. Registration is available now for only $80 with raffle prizes for all competitors and the opportunity to win cash prizes for the top performers. We will be back at the Athlete Lab in Little Canada, Minnesota on Saturday, September 28th, and accepting video submissions for online competitors. Go to TwinCitiesKettlebellClub.com to register today. Come, answer the call of battle. Join us and fight for your clan, fight for yourself, and claim your spoils and your glory. And may your name forever ring out in the Hall of Champions. Sign up today. TwinCitiesKettlebellClub.com. All right, welcome back to the Platform Podcast. I'm your host, Jordan Kundi-Wright, and with me, I have my good friend, Brenna Thompson, RD, registered dietitian. Thank you for coming back, Brenna.
Oh, I'm happy to be here.
So for today's topic, I decided to bring Brenna in because we're going to talk about the hot topic of 2023 and 2024, which are injectable weight loss drugs. So this is like the great weight debate that's going on right now out in the space of weight loss and diet, in the nutrition fields and personal training. And you're hearing a lot about it. At least I'm hearing a lot about it. Brenna, are you hearing a lot about this in your practice as well?
So since I work for a psychologist, and I do treat all ages, but a lot of what I see are mostly like teens, kids, and adults struggling with anxiety, depression, and ADHD. I've had a few patients, the adults, who have been on it or who have asked about it a little bit, but it's not the main thing I'm hearing. However, in the podcast land that I listen to, it is all over the place.
Yeah, you go Google search, for any of these, or you go look in the podcast, and you're probably going to find a whole bunch of stuff out there. So we're going to wade into that and put our own spin on it a little bit. But that was part of the reason I wanted to bring in Brenna is as a dietitian, she brings a little bit more authority to the discussion than I do. But with that said, I'm always going to I'll put the caveat out there. We are not doctors. This does not constitute medical advice. Your own individual situation may vary. Please speak with your own medical provider. This is for entertainment purposes and educational purposes, etc. Now that we've sufficiently covered our butts, I will ask you first. What are the weight loss injectable drugs that we've heard about? We know Wegovy and Ozempic are two big ones, and we were just talking before we started recording that they're basically the same, except, well, Wegovy is new and it's different than Ozempic. So can you give us a little bit about what are these kind of families of weight loss drugs that are out there?
So they're actually basically the same thing. So Ozempic came out in 2017, but we've had these GLP-1 receptor agonists around since 2005, actually. And so Ozempic was and is only used as a treatment for diabetes. Wegovy is the same medication, but marketed for weight loss. A couple other drugs that people will hear are the Mounjaro and the Rybelsus, are basically the same things. They're all part of that semaglutide family of medications.
Okay, you just said really big words.
Yeah.
GLP-1, semi-glucides, glucagon-like peptides. So
Yeah.
what are glucagon? So GLP-1 stands for glucagon-like peptides.
Glucagon. Glucagon-like peptides.
Thank you very much. What is it that these glucagon-like peptides do for the body?
So we make this GLP-1 or glucagon-like peptide. So we eat our food and it sits in our stomach and then it moves into your small intestine. And when it hits that small intestine, this GLP is released by those cells in that small intestine and they go to your pancreas. And they tell your pancreas, they also go to your liver, they tell your pancreas to make either glucagon or to actually to suppress the glucagon and to make more insulin. That's kind of the basic function there.
And so these all started because this functionality is the same, and it's all dealing with the pancreas and insulin secretion. As far as I understand it, all of these started as diabetes medications. They were to treat people with either type 1 or type 2 diabetes and help the performance of their pancreas, right? In this pathway. Is that correct?
Yes. For the most part. So what I learned in the last couple of weeks is that they actually, like, people started studying this peptide as when they were looking at and trying to treat peptic ulcers.
Ah, interesting. I did not.
Very interesting. And then they also noticed that it had some effects on the brain, and so there was a lot of research around its use or its role in Parkinson's, and they are still now looking at going down that rabbit hole of how could these affect the brain for Parkinson's and Alzheimer's disease too.
That's very interesting. I will have to follow up on that because
Yeah.
that's really interesting. It is interesting to me how much we're seeing the connection between insulin response, insulinic response, insulin management, and brain disorders and brain dysfunctions. Right, like
Mm-hmm.
they're digging into that more and more and trying to figure out what is that connection. Is it all the gut, or is there some other function that's going on there? So would these be considered off-label uses then, or would they now be considered on-label uses because they have been, like Wegovy, for example, is specifically prescribed as a weight loss drug? So would using it for weight management be considered an off-label use or an on-label use for this?
So Ozempic is used to treat diabetes. The Wegovy is used to treat obesity. So somebody goes to their doctor and they say, I want to lose weight. And if they're checking their BMI or their body fat mass index, and they're like, I qualify for it. I need to lose weight. Then Wegovy is being used on label. Like, it's being used for what it's supposed to. So there you have it.
What it was designed for. And
Yes.
just so we're clear, off-label doesn't mean that it's bad or negative. There are so many drugs that started for one thing as their primary on-label use, and then they found side effects of the drugs ended up being very beneficial in a certain area. The most obvious one that I can think of would be the little blue pill, which which started as a blood pressure management tool. That was what it was originally prescribed for. It was to help people with high blood pressure get improved vasodilation, and they found that when you took it for improved vasodilation to lower your blood pressure, it
Guess what
improved
happened?
vasodilation in other areas of the body, and suddenly things started working again. So
Yes. Now we can jack up the price and market it to a whole lot of men.
yeah, exactly. And I think we're seeing a little bit of that too with these, especially with Wegovy, specifically being marketed to people that are looking to lose weight, as opposed to just manage their insulin. But I'll ask an easier to answer question. Why is it that managing insulin would help with people losing weight? So it's a benefit that people are seeing, but the intended effect originally was to help people manage their insulin. Why would those two things be correlated?
So when we think about insulin, when we eat our carbohydrates, specifically those starchier carbohydrates, so things like potatoes, rice, pasta, crackers, cereal, um, some of your winter squashes would go in there, ice cream, cheesecake, all of these delicious things. We eat those, they spike our blood sugar, and we can't have high circulating glucose levels, that blood sugar. And we have to get it down. And the way the body does that is the pancreas kicks out insulin, and that insulin acts like a key. It unlocks your cells, and then your cell is able to pull that sugar into itself and use it to either burn energy, or it gets stored as fat if we've just completely saturated both our muscle and our liver glycogen stores. We start storing it as fat. Um, but the problem is, over time, our cells can become insulin resistant, and so they're starting to tune out that insulin message, and our pancreas has to start putting out more and more insulin. And as we do that, we become more and more insulin resistant. We don't want to hear that message. We don't want to bring in that sugar, that glucose into our cells. And so we continue to just store it away as more fat. That's the easiest thing for us to do with that excess energy.
I'm chuckling to myself because I just had an image of an analogy. It's like when my son is on his pad and he puts his headphones on and he can't no longer can hear anything I'm saying because now he is fully engrossed in his pad and so it's like the only way I can get him to pay attention is be like, pause that, take your headphones off.
It's where you like take their headphones away from their head and you're like, hello, I'm speaking to you. Yes.
It's kind of like that when we become insulin resistant, the signal is no longer being heard from the outside because there are
Correct.
other things other things blocking those reception channels, and so we become insulin resistant, and what we want is insulin sensitivity because that then decreases the amount of insulin that's necessary for our body to perform its functions the way it's supposed to, regulate its blood sugar so it goes to working muscles and working cells and not being stored as fat. Is that
Yes.
your summary? Okay.
Yes. Fair summary. Now, here's the interesting part. So, when the job of GLP is to, if our blood sugars are high or elevated, is to tell the pancreas we need insulin. So, it makes it spit out some more insulin. So, this is kind of the weird part that I'm still trying to wrap my head around is how is it that when we're telling the pancreas to make more insulin, because that's what the GLP-1 agonists do, is they tell you to make insulin, is how is it not making us more insulin resistant?
Hmm.
But there's another piece in here is where after a while, for some people, it's like their pancreas has been making so much insulin over time, is it just kind of even loses that message of like you're supposed to even make it. And so now we've got, some people are going to be insulin resistant with high insulin levels, and then some people we start seeing them insulin resistant, and down the road we start seeing them not even producing enough insulin too. Uh,
So how much weight loss is actually associated with these types of drugs?
People are losing basically 15 to 20% of their body weight on these medications. And this is the first time there has ever been a weight loss medication on the market that has seen numbers like that. So it is impressive when people are on it and it works for them, they do lose weight. And a fairly substantial amount of weight. And for some people, that can make a massive difference in the quality of life that they are able to live. Um, just
Now,
between pain management and ability to get around and just do, tasks of daily life.
okay. Yeah, that makes sense. And now it's also expensive if I'm
Yes.
if I so one of the negatives if we're talking so positives it's gonna improve your insulin response, in we're not quite we're not quite sure why the making more insulin is necessarily a good thing, but it's getting your pancreas to make more insulin, and it is helping reduce body weight, which we know will then improve insulin sensitivity over time as well, right? So we know there's all sorts of associated benefits with reducing your body weight and life expectancy, quality of life, all of those things. But some of the negatives here are it's expensive. It's typically, at least at this point, unless I'm mistaken, and it could change. But as far as I understand it, like very few insurance plans will cover this drug. So it's expensive and it usually comes out of pocket. Is that your understanding too?
Depending upon your insurance, I don't know how much somebody's going to pay for it. If your insurance pays none of it, we're looking at over $800 to over $1,000 per month
A
for the
month.
medication. And these are once a week injections.
Yeah, we should specify that. Thank you. That's yeah. So this is one of the nice things about this is it's a once a week thing. It's not a thing that you need to do every day or multiple times a day. So it's, as far as ease of implementation, fairly easy to implement because it is only one injection per week. Dosage varies based on the size of the human, I would assume.
So it starts out at a pretty low dose of, I think it's like 0.5 mLs. And then depending upon the practitioner you're working with, and that's the big thing is if somebody wants to try it, they have the funds to do it or the insurance to do it. Finding a practitioner who knows how to dose it, how to increase doses appropriately, and then keep somebody on it or bring them off of it. safely. And so typically they start out at that 0.5 ml, and then they will work up to the top dose, which I believe is 2.5.
Okay. All right. So now I'm curious. Part of the reason I wanted to talk about this is because I am getting questions about it. Like you said, we're hearing about it. You don't work with people in this space as much because you focus more on people with behavioral issues and things that you mentioned before. I personally have been getting a ton of questions about, well, I was thinking about trying this. Should I try it? Should I not try it? What are the side effects? Et cetera, et cetera. And people often think that I come with they come with a preconceived assumption about what my positions are. I'm curious, based on what you know of it right now, how do you feel generally about the use of these drugs for weight loss and for people that are using it for that purpose, like they want to lose weight?
I think we always talk about it depends.
You had to go with the nuanced answer.
Yeah, that's so nuanced. I think for some people, I would almost put it in the category of it could be life saving for them, in that if they have legit tried to lose weight. I'm talking about my patients where they have been on every diet, they have tried to lose the weight. Maybe they've been successful in the past and they've lost 30, 50, 100 pounds in the past, and then they try to keep it off. And for so many reasons, they can't. It's hard. Life happens. We can also talk about the fact that when people lose a lot of weight like that, we have this thing called our extracellular matrix around our fat cells, and it does not like to be empty. It does not like to have to remodel. The easiest thing to do is refill it with fat. Our body's very good at that. And so whether somebody's lost 20, 30 plus pounds and maybe they keep it off for a while and then it comes back, but then what do they have to do to try and keep it off or to try and lose it again? So I start thinking about that for my patients. But then I'm just thinking of one woman that I did work with where she said when she was on the medication, she goes, for the first time in my life, I'm not thinking about food all day long. She goes, I can actually think about the stuff I'm supposed to be thinking about at work. I have the energy to clean my house and to think about doing other things and to actually live my life versus all day just being like, am I hungry? Am I not hungry? When am I going to eat? What am I going to eat? And, and then eating and then feeling guilty about it. And she goes, the food noise is gone.
Hmm.
And for her, that was just liberating.
Interesting. I'm really curious if that ties to ghrelin secretion then, because that to me
It
that sounds
does.
like a decreased level of ghrelin is being present in her brain. Okay, you said it does. Or did you see a study that I didn't see?
So what it does is so these medications, they decrease blood sugar, they slow gastric emptying. So food stays in the stomach longer, making you feel full. It helps decrease overall inflammation in the body. And then it does help decrease ghrelin levels. So
Yeah, and I could see if it slows the rate of gastric emptying, those typically they're fairly correlated. Gastric emptying, the rate of gastric emptying, and an inverse relation with the increase in ghrelin. Right, as food leaves the stomach, your body starts producing more of the. And ghrelin is the hunger hormone. I always tell people ghrelin makes your stomach go grrr. Right, that's how I remember. Is when ghrelin goes up, that's when you start getting the stomach grumbles that tell you that you're hungry. So that to me that makes sense. That tracks logically with if we know that it slows gastric emptying, that it would also slow the rate of ghrelin production. So that's really interesting. Though that's the first story I've heard of a anecdata of somebody saying it because they weren't hungry. It's allowed them to focus on something other than food.
yes.
That's really really interesting. I feel like that's potentially powerful too.
Yeah, and I think that's where I see the benefit of it. Now, are there plenty of people who are going to go to their doctors and ask for it when maybe they don't need to? Or I don't want to say they haven't actually tried to lose weight the healthy way. Um, I think a lot of people go on diets, but it's a little bit half-hearted.
Hmm. So how do we balance? Because that's always the thing that concerns me about it, right? And so
Mhm.
I've had a number of clients ask me about it, and even people that I have been working with on losing weight, and people that have successfully lost weight in the past. And so I'm usually, I don't want to say bipolar about it, but I vacillate back and forth. And this is part of the reason I can never give people a clean answer on it when they're like, well, how do you feel about it? Because there's a part of me that's like, well, if you've been successful losing weight in the past, is the problem really something that you need an exogenous substance to help, introduce into your body to help? Is it really something that you need? Because if you've been successful in the past, then you should be able to be successful in the future. But then I toggle to, but were they really successful if they regained the weight? And then is the source of the problem actually biological, or is it psychological, or is it psychosocial? Right? It becomes this really challenging, like, how do you unpack and unravel whether or not when somebody asks you as a practitioner, if somebody asks you, and when I say you, I mean me, right? But for either of us, right? If somebody asks you, should I do this? I've been really thinking hard about it. Should I do this? Like, it's a tricky answer, because there's the part of me that is with you. It's like, well, how hard have you tried in the past? Have you been successful in the past? Is this really the right answer, right? And I don't know. It always depends on the person in front of me, is kind of how I feel about it. But there's a part of me that, like, there are people that really piss me off in this space, and part of the reason I want to talk about this, and there are trainers and nutritionists and uh, podcasters and whatever influencers that will say, no, this is terrible, you absolutely shouldn't do this, you're not working hard enough, you're not trying, like, you don't need these drugs, like, anybody that needs these drugs just hasn't tried hard enough, or they're not strong enough, or there's a very judgy type of perception about
Mhm.
this. And even the people that have asked me have honestly felt like I was going to be like, oh no, you absolutely shouldn't do it that way, like, because people know I'm like the sustainable weight loss guy, like, I'm all about, like, building habits, and like, don't
And
do
all
any,
the feel good stuff and,
yeah,
like, eat the real food
don't
and
do crazy, and like, lose it slowly and lose it steadily, and but at the same time, like, people that are telling others without understanding what their experience has been like, or how hard it's been, or how, like, yeah, maybe they successfully lost 100 pounds, but maybe that entire time, like the person you were talking about, they were fucking obsessed with food and
Mhm.
could not stop thinking about it, because they were always hungry, or even when they weren't hungry, they were still thinking about, like, okay, I'm full right now, but I can't. When do I get to eat again? Like,
When do I get to eat? What do I get to eat? Oh shoot, I ate too much and now I'm just going to go down the shame rabbit hole and just maybe
the
it's binge, purge.
eat
What
shame.
does it trigger?
Yeah, yeah. Like, I don't know. So
So,
I don't feel. I definitely feel I'm not in that camp where it's like you absolutely shouldn't do it. I'm definitely not in that camp, but I'm also not in the camp that's like, oh, Wegovy for everybody.
no, no. And
Anybody that wants to lose weight.
I think when people, whether they're listening to this and they're considering it, or they just want information, or they're asking you, the other question is to ask them, okay, so let's say you lose 30 to 60 pounds while you're on the medication. Then what?
What's the exit strategy?
What is like, are you going to have an exit strategy, or are you going to be somebody who titrates down and you're on this for the rest of your life?
And that's okay. There's
And
no,
that's okay.
there's no,
Like, here's the thing. If you're like, you know what? I'll be on this until I'm 70, 80 years old because it means that I don't go back to whatever place I was at. Cool. Just know that that means that for the rest of your life, once a week, you have to give yourself an injection. And is that the worst thing in the world? No. Are they fun? No. But
what are the side effects? I guess that we didn't touch on that. Like, what are the side? I know what some of the side effects are, but I'm gonna ask you, because you're the one with the credentials here. So,
so the main side effects are nausea, vomiting, diarrhea, heartburn, abdominal pain. Those are the big ones.
oh, that sounds
And
fun.
yeah, a lot of people will experience those when they first start the medication and then when they increase their doses.
Mm.
Um, some of they can also feel very fatigued, but also get headaches. However, one of the shows that I was listening to with an endocrinologist talked about the fact that most of those headaches and the fatigue comes because they're not drinking enough.
Mm.
Because not only does it shut off our hunger cues, but it shuts off your thirst cues. And so people stop drinking. So the big thing is if you're going to start it, make sure you are drinking enough. I'd say, like, use some salty water. uh, get on the electrolytes.
Element.
Element, I know.
Hashtag not a
Uh,
sponsor, but we love them.
yes. Uh, but making sure they were like, if people stay hydrated when they're on it, the fatigue and a little bit of the nausea and the headache will start to go away, uh, just by staying hydrated. And then some of the other, like that feeling of nausea sometimes is just because people are like, oh, I'm actually full, or they're learning how much they need to eat to not feel over full and stuffed. So there's a learning curve with it.
Yeah, I mean those are going to be similar symptoms to what you're going to experience if like because I've also had people that got like a gastric sleeve or
Mhm.
got stomach surgery. This is far less invasive than that, and there were people that asked me about that I was like, yeah, you absolutely should go through with that surgery because it was going to be life saving for them, right? Like
Yes.
that's the thing is like I think part of it is we have to measure this against what is the benefit and what is the potential risk of not changing, right? Like if somebody is morbidly obese and they've tried a number of different ways and they're like, I need to get this under control. Like if you're 100 pounds plus overweight, like you're on a curve that's not great, right? Like your life expectancy goes down significantly, right? And for a lot of people, they just know that they're headed down a path that is not great. And so for me, I feel like it's irresponsible as a practitioner, for anyone as a practitioner, to discourage somebody from leveraging all possible options. Of course, you have to weigh the risks and benefit, and you have to assess the person that's in front of you and talk to them and make sure that that it's not a parachute, right? Like this is well, maybe it is a parachute. Like if we're talking about if it's potentially life saving, like you're falling to the ground and you're going to die, right? Like if but
Yeah,
if
like yeah.
if they're not in that level of severity, right, where it's uh you know vanity, right? People, that's another thing I hear people say, well, this is just a vanity thing. It's like, is it really a vanity thing to want to lose 60 pounds if you know you need to lose 60 pounds to be healthy? I don't necessarily think that's a vanity thing, but that's neither here nor there. I feel like it's one of those things that you have to look at it from the perspective of, I equate it to like, would you tell somebody that has cancer that they shouldn't do chemo?
Right.
It, most,
And
I
we
obviously
can
I'm
take it a
not
step
top.
back from that and say, well, if somebody has high blood pressure, are we going to offer them a blood pressure medication? Like along with, and here's the thing is, if you're working with a skilled practitioner who knows how to dose this and use it appropriately, not only should they be dosing it appropriately, they should also be telling you to eat a healthful diet
Yes, this
and
is not the
and exercise. Because here's the other thing is, yes, you will lose weight on it, but if you are still eating just mostly carbs and processed foods and you're not exercising, what are you going to lose?
muscle.
Muscle, not fat. And that's part of the other problem is then if people go off of it, now we've lost muscle, we haven't lost fat. I mean, we've lost some fat. Um, but then when we regain the weight,
But yeah, if you focus too much on just losing weight and you're not focused on changing body composition, which is a conversation you and I have had a lot of times about, people are overly focused on losing weight and we're not thinking enough about what does that weight comprise. You can be skinny fat at 150 pounds or you can be lean and mean at 150 pounds, right? Like
mhm,
either of those things can be true. Weight is just the gravitational force applied to your body, right? Like that's all that's measuring. It doesn't tell you what you're actually made up of. And that sarcopenia, which is just muscle wasting, is that's just the medical term for muscle wasting. Usually it's associated with age, but one of the side effects they list for these medications is sarcopenia. You may lose muscle tissue as you train these, but as you take these. But one piece of emerging research that I read recently was that when you pair this drug, any of these drugs, with a high protein diet, and by high protein, I'm talking like 1 gram per pound of body weight, target body weight. So like if you're 300 pounds trying to get to 200 pounds, the prescription would be 200 grams of protein a day, right? If you pair it with a high protein diet and resistance training, the level of sarcopenia is negligible,
yeah,
right? there's no greater sarcopenia when using this drug if you keep your protein high and your resistance training high than there is associated with any other type of caloric deficit. You are always going to lose some muscle tissue when you put yourself in a state where your body is losing tissue. Like, you put yourself in a caloric deficit so you can reduce your body stores. That's what we do when we want to lose body fat. There is always an associated level of muscle loss that goes with that. But the way that we mitigate that and make it as small as possible, we resistance train and we eat a high protein diet. Guess what? Those things work whether you're doing it with the assistance of a drug or without. So if you're hearing from people that these things aren't good because you lose a bunch of muscle, that's not fully true, right? But that's why it's important that you have a holistic perspective on this. And this is not the only tool in the toolbox. This is a holistic approach to changing your body composition. This is one tool that's part of that, along with a healthful diet, along with resistance training. And I would also argue, along with some type of identity work and like internal work, either working with a therapist or working with a coach or doing self-help or some type of other thing to work on the psychology of what got you to this place in the first place. What is your relationship with food? And maybe that relationship with food is triggered by some of the ghrelin effects that we were talking about. But like, I feel like all of those things need to be encompassed in a plan if we're going to introduce something like this. Sorry, I'll step off my soapbox.
I don't even know where to go after that.
You can just tell me to calm down. That's always acceptable.
Calm down, because that works for everybody, right? Somebody's mad and
Exactly what you
angry.
do when somebody's escalating. You just tell them to calm down.
Calm down. Yeah, I think it's, and then I think somebody could come back at you and argue, well, why do you need a medication if we should just be eating, 200 grams of protein and lifting weights?
And my response to that would be, have you tried that yet? If you haven't tried that yet, that's always part of the conversation I have with somebody if they're talking about this. Like, well, what have we tried? Right. And so for people that I personally have recommended, when they asked me, that I said, yeah, I think you should give it a shot. It was usually people that have spent, like you said, many years, have either successfully lost weight but then regained it multiple times,
Yes.
or they've tried a ton of things without success. Right. And like, there is nothing worse. And one thing that people need to be aware of, there is a biological portion. There is a portion of the population that biologically does not respond well to resistance training. Like, everybody thinks that resistance training works for everybody to change your body composition. There is a small percentage of the population that just does not respond well to exercise, that just, it doesn't affect them one way or the other. Right. Like, it's really interesting, but there is a group, and maybe there are people that are like that. It's just like they've never responded to diet and exercise, right? But like, if you haven't tried those other areas, like you haven't worked with a coach before, you haven't worked with a good nutrition coach, you haven't done it, you haven't done a strong resistance training program, right? Like, I would go down that route first. But like, for a lot of people, they've tried that. They've tried working with coaches. They've tried resistance programs. They've hired a nutritionist. They've hired a dietitian, right? Maybe they had some success, but then they fell off, or whatever. It wasn't sustainable for them, or they didn't have success at all, right? If you haven't had success with those things, I don't feel like there's anything wrong with trying an exogenous approach that might help, paired with these other things that we know work.
Yeah, it just because somebody decides, well, I've tried the things in the past and now I'm going to do the medication, doesn't mean like I'm just going to do the medication and go get Chick-fil-A all the time.
So you're saying it's not a magic bullet?
It's not a magic bullet, because then, people talk about like, oh, I mean, some people will say, I want to use the medication as a kickstart or as a way to lose the weight, lose the fat, so that then I can continue with like different habits, or I want to try and lose some of the weight so that I can move better, so I can do more at the gym and do more of the exercise. Because I mean, you and I have talked before, like what I can do for a yoga pose is going to be very different than what you can do for a yoga pose, just based on our physiology.
I have a whole playlist on my YouTube channel called Big Man Mobility, and I've sent it to other people. People are like, I'm not sure this applies for me. I'm like, yeah, it was poorly titled. I need to retitle that. But these are just general yoga poses, but it was just me doing them. So that was that was why I titled it the way I did. Didn't mean that was prescriptive, but yeah, it's, I don't know. I find this to be really interesting, and I'll be interested to see what the longitudinal data starts to look like, because that's the other thing that I think we need to call out and couch this in, is like, these are still relatively new medications, so there's not a ton of longitude, and especially in how they're now being applied. Like Wegovy is now being marketed as a weight loss drug, so we're not going to see a much larger sample size, and we're going to see what are the effects of people over periods of years where they've been on this, or they've tried this, they were on it for a period of years and then off of it, right? We'll start to be able to hopefully see some analysis of the longitudinal effects of these. But I think in summary, my feeling on this is that it is a useful tool to consider if you have tried many other interventions without success before, and that you should work with a professional who has a well-rounded holistic approach to it, and that it might be useful if you can afford it, and I think it's worth considering depending on your situation.
I think that's the best thing I've heard from any podcast so far.
Yeah, you
You know,
did it.
the other thing I would caution with it is it's, we're cutting people's food intake by 1 to 2/3. Most people end up eating 1 to 2 meals a day when they're on it. And with a decrease in food intake comes a decrease in micronutrient intake. So then I start looking at, okay, like, what are people going to become deficient in, or what were they already deficient in?
Mm.
And how are we going to see that manifest down the line? Um,
Yeah, so that's a really good call out, and that is something I had thought about as well. So I'm curious. I'm putting you on the spot here. I know I didn't prep you on this, but like, if we're thinking about it, and we decide, you've got somebody that tells you, like, I've decided I'm going to do this. What would be the tips that you would give them to help mitigate what the known side effects are? Like, if I came to you and said, yeah, I'm going to start doing Wegovy injections because I want to lose, 80 pounds, right?
mhm.
What would you tell somebody as your tips to, like, mitigate those negative side effects that we're, potentially aware of, or that we're aware of, or think are potentially there, just based on the mechanism of function that we know exists?
So I think we're going to go with what we already talked about, which would be just eating enough protein. So when they sit down to the meals that they're going to eat, is eat your protein first, veggies second, have your starch last. Um, so that as they are eating, we know that we're hitting their protein targets first. And then we can fill up on some of those non-starchy veggies just for the fiber, the vitamins, the minerals that come with them. Get the starch if they're hungry enough for it, um, and go on from there. And then if we're talking about supplementation, I mean, I right now I'm putting everybody on vitamin D
Yep.
because it's Minnesota in the winter.
Oh yeah, sure.
Yeah.
Haven't
Uh,
seen the sun in a month. Yeah.
so vitamin D, but then I'm also going, okay, if people are eating less overall, and even if we're having them eat their protein, they're probably going to end up being lower in their B vitamins. So I'd probably just put people on a really good either B complex or a higher dose multivitamin. So we just have a lot of our bases covered as an insurance policy.
Yeah.
Um, and
Would you recommend, like, any type of blood work or mineral test, like anything, like, would you, because there's the, like, money, if money's no object, there's the scientist in me that would be like, let's do blood work on everything. See, do you have any vitamin and mineral deficiencies at the start, right? Get all of the data that we can, start them on their, on the specific supplements they need for any deficiencies they have, right? Do the protein thing, like, monitor that. Like, how far would you go down that rabbit hole? Because you can spend, just as much money on supplements a month as you are on the injections if you're not careful.
I mean, and that's where I would say, we're going to your physician, and do we just have a baseline on your cholesterol, your A1C? Do we have a fasting insulin on somebody? Where is your vitamin D level? For women in particular, I'd want to see their iron, their ferritin. You can get a B12 unless somebody, I don't ever really order B12s or folates on people unless they are like vegetarian or vegan. Um, it's not a But I mean, that would be something to look at. That, or if they've had gastric bypass surgery. Uh, Most people are deficient in magnesium, so I put just about everybody on that one too. Um, so you can't, the problem with trying to test things like magnesium through just a regular serum blood test is the fact that your electrolytes, so magnesium, calcium, phosphorus, potassium, and sodium, are so tightly regulated in your body that unless you are going through some like big metabolic shift, they're basically going to look normal. They might look a little bit high normal or a little bit low normal, but if they're in range, your doctor's just like, it's fine. So unless you're going to do something like a SpectraCell intracellular test, it's not going to tell you much.
And I think that's why we both just are like, take one pack of element a day too, just to cover your bases, keep your electrolytes kind of in balance and where we need them, because we know most people probably don't consume enough of, especially of magnesium and calcium, phosphorus, but
well, and I will say that I have been recommending element to so many people. I know it was created for more of like the low carb, the keto, the fasting, the like highly athletic. But I have so many patients that I have taking it because what have we been told for so many years?
Salt's bad.
Salt's bad for you. Don't salt your food. And a lot of people have gotten that message, so they don't do it. The other message we get is, how much water are we supposed to drink? Like
gallon plus.
A gallon a day. I think there's, what is it, the like 75 something challenge in the 75 hard. And you're supposed to drink a gallon of water a day. Jordan, if I drink that much water, do you know how I feel?
Probably bloated and like you're probably on the toilet peeing.
I feel terrible. Like, you already know it's hard enough to get like 1.5 liters in me.
Yeah.
But so we have this message of don't salt your food and overhydrate all day long. And so I have patients who are like, well, I'm just kind of like tired and fatigued all day. And like, I get these random headaches and da da da. And I take their food inventory and then what they're drinking. I'm like, your electrolytes are way out of balance. Like, it would probably look normal on a lab, or maybe their sodium's a touch low. I get them starting to use 1 or 2 packets of element and to quit drinking a gallon of water, and they feel better.
Weird.
I know, it's crazy.
The more is not always better. That's the whole thing. Like, that's the thing. Like, that's the thing that always. I maybe could do a whole other podcast on the 75 hard thing, but like that whole thing of like, oh, you need to drink a gallon of water. It's like, says who, right? Like, and if that, like, I'm literally two of you, like. I should drink a gallon of water and you should drink a gallon of water. Like, I'm twice your size. Like, there's no reason we should have the same water prescription. That makes zero sense. Like that just sorry. Tangent.
No, and if people are wondering, the basic recommendations for water is to take your body weight in pounds, divide it in half, and that's how many ounces you should drink
a day.
A day. Now, that doesn't take into account if you live somewhere where it's really hot, if you have a job where you're extremely physical and you're sweating a lot or doing whatever. Then there's a bunch of other calculations you can do on top of it. But that's your starting point.
Well, like I just did a nutrition seminar for fueling and for fueling for athletes, and one of the things that's in there is about hydration. Is our body has a built-in feedback mechanism for our level of hydration. It's called our urine. like you really just ultimately like need to be peeing like light yellowish to clear a couple of times a day. And so long as that's happening, you're probably adequately hydrated. If you're peeing clear all of the time, you're probably hyperhydrating, right? And like, and if your pee is like, rusty, then that's a whole other thing, like that's then you're dehydrated. But like for most people, like so long as you use that feedback mechanism that your body is already giving you multiple times a day, like you're probably all right. And supplementing with some type of electrolyte or making sure that your electrolytes stay in balance, because it's not just about water that keeps your cells actually hydrated. Your electrolytes are super, super important as well.
Well, that was a tangent.
Yeah, I'm good for those. Thank you very much, Brenna. Any other things that you want to make sure that we call out that I didn't ask you about, that you want to make sure we call out about the injectable weight loss drugs before we wrap for this episode?
I mean, I guess the only other thing that we didn't really cover was like, people will say like, I need to lose weight. I have a lot of weight to lose, but who's actually qualifying for using the medication? Technically, people should be 30 pounds over fat, meaning that they're carrying 30 pounds of extra fat. Not, somebody who's extremely muscular is not going to be given this medication. Um, but also looking at their other metabolic risk factors. So having high triglycerides, low HDL, high blood pressure, high A1C would also be qualifying factors for it. So
Yeah, that is a very good call out, because I think with that filter, you can say it rules out a lot of the people that people would be judging for. These are vanity seekers, right? Like, it is not something that you should seek to use if you just want to lose 15 pounds. And I don't think there's a physician out there, at least not a reputable physician out there, that would prescribe it to somebody that's like, oh, I need this to help me lose weight, and they're like, well, you don't you're you don't have 30 extra pounds of fat that you need to lose, right? Like that helps qualify out people that are just looking to lose that little bit of extra, or that stubborn 15 pounds that they can't get rid of. It's not for that.
no, nope.
Awesome. Well, thank you very much. I apologize for my tangents, but this gets me triggered in a number of ways. But thank you so much for coming on and bringing your expertise and your professionalism to it, because I can't be trusted with these types of topics. I really always appreciate you being willing to hop on with me, and love having you on. So thank you so much, Brenna. We'll talk again soon.
Well, thank you. Have a good day.
Yeah.